Joining me now is Dr. David Rose. He is an associate professor for USF, a vascular neurologist, a medical director at the Neuro ICU Comprehensive Stroke Center at the University of South Florida in Tampa General. I love short titles. It was so easy to get through.
Right.
Thank you so much for joining us today. We're going to talk about something that's extremely important because time does make a difference on this one, strokes. And this is obviously the month of stroke awareness, so thanks for joining us today.
My pleasure.
And let's talk about stroke. The biggest issue is that there's not just one stroke. There's two different types and they're treated differently. Tell us a little bit about that.
Sure. So we have two flavors of stroke, chocolate and vanilla. No, I mean hemorrhagic and ischemic. So hemorrhagic is about 20% of all strokes, and that's bleeding in the brain, which can be caused by a rupture of an artery, let's say from high blood pressure, for example. And the other flavor, about 80% of the time, is ischemic stroke. So it's a clot in the brain where one of the pipes is plugged, it's clogged, and therefore not enough blood and oxygen reaches part of the brain and it dies and it causes a neurologic deficit.
So we were talking about time, obviously. So symptoms obviously has to be the biggest piece because people have to know, hey, something's going on for me to go to the hospital.
Right.
Tell us about the symptoms because they're not always exactly point perfect.
Right, so our mnemonic is FAST, F-A-S-T. F is for face, so if you have a facial droop or you see your loved one starting to have a facial droop, that could be a sign of a stroke. A is for arm, so we ask a patient to put their arms up in the air like this, and if you notice that one starts to droop down like that, then you know that could be a sign of a stroke. S is for speech, so slurred speech or trouble getting the words out or even understanding speech. That's called aphasia. That's a speech problem. S, that could be a stroke. And T stands for time, so get to the hospital as soon as you can. Call 911 and go directly to the ER.
Sure. Now, since there's two types of stroke, one being a bleeding one where blood is going into the brain, the other one's blocking, treatment's being a little different, everybody has to have a CAT scan first. So when you come in there, you just can't give somebody medicine. So that takes some time, so we're talking about that. Talk about what we should do when we start noticing these processes.
So if you're at home or, at work or whatever, you see someone with one of these facial droops or slurred speech, etc., just call 911. Do not go ahead and give an aspirin. It's not the same as a heart attack. It should be treated with the same type of acuity and respect because it's very emergent. But we don't know until we get a CAT scan of the brain if it's a bleeding or bleeding hemorrhagic stroke or an ischemic clot. If you gave an aspirin, like you did for a heart attack to a bleeding stroke, that could be making it a lot worse. So let us make the decision when you get into the ER to go ahead and decide upon that or not. The other thing we should note that as soon as the onset of the symptoms start is when the clock starts to tick. So you have 4.5 hours to get to the hospital and receive the most powerful clot-busting medication that we have, the strongest blood thinner if it's an ischemic stroke, to help reverse the stroke, to help unclog that pipe and restore blood flow to that starving brain tissue. It's not quite dead brain tissue yet, it's dying, and if we could open up that artery and restore some blood flow to it, then the function could come back and we could be left without a stroke.
And we know this is not an isolated issue. About 133,000 Americans have problems with strokes each year and actually die from it. Probably more than 133 actually have strokes.
Yeah, about 800,000 will have a stroke in the U.S. every year.
So a huge part of the population. What's the major cause?
Hypertension, 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 hypertension. High blood pressure is it. And actually the American Heart, American Stroke Association just changed the guidelines this year in 2018 in Los Angeles, a big meeting, and they said, you know what, let's lower it even further. So instead of the old definition of hypertension being 140 over 90, it's now 130 over 80. So if you're over that, you have hypertension, and certainly if it goes higher than that over years, it can wind up provoking heart attack or a stroke or other problems as well. And we call that the silent killer because you don't really feel symptoms of hypertension until, bam, it's too late and someone has a stroke. Yeah. So we definitely have to be on top of that. Our primary doctors have to be vigilant, and so do we. We have to take control of our own health, know what our blood pressures are. I tell my patients to write a diary down. Put it in your smartphone or write it on a pad, and, check your blood pressure often if you go to the supermarket or grocery store or drugstore and every day, 3 times a day if you can, just to write it down and make sure it's good. 120 over 80 is really the goal, or lower.
So obviously we do a poor job at this. We have a lot of excuses for it. I ate too much salt yesterday. I was driving to the office and I got mad at somebody. Or we have white coat syndrome. All of those are excuses that allow us not to treat the hypertension. And probably the biggest one that I always have for my patient is, Well, I took my medicine. I don't have hypertension anymore. So I stopped taking my medicine, and I didn't tell my doc about that.
Right. It's not really a cure. It really just is a maintenance. It's like your car. You really want to put the oil in every, couple thousand miles. Same thing is true with your body. You really, are not going to be cured of this long term. You got to take your medicines. Now that medicine doses and the number of medications may fluctuate over time. That's why you have to keep following up with your primary doc about this, because it's one of those things that'll always pretty much be with you, either from your diet, or even if you have the best diet in the world, you have genetics that are something, those are things we just can't control, our DNA. So just got to deal with it ourselves.
Yep, if your parents have it, you might have the same chance. We will follow in their same footsteps. Now, strokes, obviously, the 133,000 people dying, big deal, but the 800,000 actually have a bigger deal, because this is a life-changing event most of the time. Talk about, once the diagnosis is done, once the damage is done, what can we do about it?
It's a great question. So, once the patients are in the hospital, we find out the cause of the stroke, so we try to have secondary prevention. And then they wind up going to a rehab facility or a long-term care facility, or maybe even a nursing home if their stroke is severe enough. And, that's the #1 cause of disability, not just in the United States, but around the world, is stroke. And so we just need to do a better job of controlling the risk factors to prevent this type of long-term problem. There's not a whole lot more after the brain tissue has already died that will help restore it. Now, there are some fancy trials, with stem cells and everything, but that still is a long way off. The brain does rewire over time. People do get better from their strokes, but it takes months to years a lot of times. So it's a major public health burden, and we're trying hard at our university and at Tampa General Hospital to do some active research to try to prevent stroke from happening, also try to fix secondary stroke, but there's still a lot more that needs to be done.
Sure, and it's not an age thing. Obviously, we always think, well, strokes come to people over the age of 70 or 80 or 90, but statistically, we can have it at any time.
Oh, absolutely.
And we have some patients that are obviously a lot younger. It seems much more detrimental because you're looking at a young person, but stroke to anyone is a huge deal.
Absolutely. We've seen even little babies with strokes. I mean, it can affect any age group. Kids can get strokes from congenital heart disease, for example. We have teenagers getting strokes from automobile accidents, any kind of injury to the neck, motorcycle accidents, roller coasters, neck manipulations, anything that'll injure your neck and can tear the artery there can form a clot as the body tries to heal the artery that then flicks off and goes to the brain. And then, of course, we have a big one, which is atrial fibrillation, which is an irregular heartbeat, right? So, if you have a genetic AFib, or if you just get it because of risk factors like hypertension and diabetes and cholesterol and smoking, your heart can weaken over time, and then that can lead to AFib. And then, we need to know this, so we go ahead and treat it with the strong blood thinners to prevent a stroke, from flicking off a clot from the heart into the brain and causing that clogged pipe.
Yeah, so obviously the primary piece is prevention.
Absolutely.
Prevention is 100% successful and uneventful. That's our whole idea. And the treatment itself, if done in time, has the opportunity to reverse it. But statistically, most people miss that window, and we have permanent damage, which causes a lot to them.
Yeah, only about 4% of actual stroke patients in this country qualify for that clot buster, blood thinner we were talking about earlier. Now at Tampa General, we're one of the only comprehensive stroke centers in the region, certainly the only one in Hillsborough County that's nationally accredited. And what that means is that if you're beyond the 4.5-hour window with your stroke and it's large enough to qualify for embolectomy, what we can do is perform one of those with our 24/7 neurointerventional coverage, meaning that we have specific doctors that are trained in doing catheterization, snaking a catheter up through the artery in the groin, past the heart, past the neck, into the brain, and taking out that clot from the brain. And just recently, part of the guidelines have changed from just 6 hours window to do that to 24 hours since the onset of the stroke to go ahead and do that in certain qualified individuals. You have to have a lot of medical indications and no contraindications to get this procedure. But that being said, we certainly have a lot of those, and our business has been very booming since the new guidelines have come out, because a lot more people now qualify. Instead of just 6 hours, we've basically quadrupled the time for which we can go ahead and treat the clot removal therapies with our services that we offer at Tampa General.
Yeah, amazing stuff. Obviously, prevention, primary piece. The other stuff is a hit or miss, but we always say thank you for your expertise. Thank you for the time and energy that you put into it. Thanks, Tampa General, for putting that center in place as well. Lots we could talk about. Unfortunately, we don't have much time for that, so thanks for joining us so much today. And hopefully, prevention will be the key piece.
Absolutely. Thanks for having me.